Um, Hello, everyone. This is Hiba Hussein. I am the Sexual Reproductive Maternal Neonatal Child and Adolescent Health Officer in WHO Sudan Country Office. I've been requested to speak about and talk about how to monitor child and adolescent health in emergencies as one of the priority areas in the entire emergencies globally. Child and adolescent health is one of the identified priorities in Sudan in both developmental and emergency situations. We see that child and adolescent health among uh, the list of priorities for both government and health partners in Sudan. This has been reflected in different manners and approaches, started by identification of child and adolescent health as priority at the policy level, strategy level, national programs, as well as having dedicated subnational programs at the subnational level to provide child and adolescent health services. We know that Sudan is one of the countries in EMRO region that have been through different emergencies, varies from man-made emergencies and natural disasters. In Sudan, we have a history of facing different emergencies, starting by Darfur crisis in 2003 and coming up to the current emergency, which was started in 15th of April and affected majority of the population, people of Sudan. Since the eruption of the current emergency in Sudan, majority of the health programs have been affected. And the health system has also been negatively affected. That led all the health partners to develop, along with the Minister of Health, to develop the health response plan to provide the needed health services for the people of Sudan, and focusing on providing emergency life-saving health services for entire population where these services can be accessible. Sudan is now the largest internal displacement crisis globally, hosting around more than 1 million displaced persons, where those people were forced to flee their houses and sitting in different IDP gathering points. Part of them have been merged with their families in other relatively stable states, while the rest are living in different gathering points of the IDPs. To respond to this crisis, the National Response Plan has been developed, where child and adolescent health has been identified as a priority under this plan, also focusing on life-saving health services to be provided for those age groups in both hot spots and relatively stable states that having a large number of IDPs, as they have been identified and defined as important category of population and vulnerable population that are in bad need to health services. This area under the child and adolescent health in the National Health Response Plan, it's focusing on the life-saving health provision of the life-saving services required monitoring system to monitor how those services are being provided up to the level of the beneficiaries. The monitoring of these interventions are being done through different approaches, starting by strengthening the coordination to make sure that all partners having the same vision in terms of and having harmonized plans in providing the services, identifying the priority areas geographically, and agreeing upon the service package that should be provided that suit the need of the child and adolescent health during this emergency. This is being done also for the coordination is being done through different platforms, starting by the health cluster members, where a health cluster is addressing child and adolescent health as one of the key areas to be monitored and to ensure that resources are available to respond to the needs of children in Sudan, focusing on ensuring accessibility by the most vulnerable population, including IDPs and also hosting communities where the health system is overstretched to provide these services. It's also being done through supportive supervisions to make sure that where it's possible, to make sure that those services are being provided in a quality manner, reaching out the targeted population. This is also being done through, as I mentioned, the cluster in terms of coordinating the efforts of the entire partners of the child and adolescent health. However, also it's being done with the Ministry of Health and engagement of the community members to make sure that to ensure the accessibility and the security as well. And also, the monitoring is the monitoring plan is also focusing on collecting data on the main packages that are being provided. And here I would like to highlight the IMCI, which is one of the main programs that are currently we're focusing on to ensure that we are responding to the morbidities, the common morbidities that are affecting children in Sudan under 5 mainly. Here we're speaking about under 5, and to make sure that we are also addressing the other components that are affecting adolescents' health in terms of providing the needed support from the other programs, for instance, the sexual reproductive health programs, where we are focusing on providing services for the GBV survivors, especially when it comes to the adolescent age group. Definitely, we're focusing different challenges in terms of collecting data. However, the focus mainly is to collect the minimum important data to make sure that we are addressing the needs of the most vulnerable population. And here, mainly we're speaking about the children and adolescents, and to make sure that they have an safe access for these services. This is being collectively done through different approaches, as I mentioned, including coordination in terms of harmonizing the efforts of the different partners, allocation of their resources, collection of the important data, agreeing upon the packages that should be provided, along with the other components that needs to be monitored and maintained. Here, I would like also to stress on the importance of how to address the difficulties when it comes to the monitoring of the child and adolescent health during the emergencies, especially when it comes to the insecurity and the issue of accessibility, where we need to be a bit agile in identifying, defining the indicators that should be monitored, how to collect this data using different methodologies, Sometimes we use mobile phones for the data collection where applicable. However, supportive supervision remain one of the main areas that we are relying on. One recommendation also is the expansion of the implementing partners and making sure that CSOs, national NGOs, and international NGOs are involved in responding to children and adolescents in the emergencies, and they are also involved in monitoring the provision of these services. Once again, child and adolescent health is one of the key priorities for the in Sudan, and monitoring, identifying the suitable interventions, and that this area is one of the areas that we need to focus on, along with having the tools for monitoring, supervision, and evidence generation to make sure that we'll be moving smoothly from this acute phase to early recovery and peace nexus, inshallah. Thank you.